Hi, this is Tiny Stansel, and we're going to talk about ovarian cancer. Just to start, a disclaimer, this video is solely for educational purposes. It is not meant to diagnose or provide treatment for ovarian cancer. We are going to start with a very basic look at the internal female reproductive system. This, of course, is the uterus, which is where a fetus would develop. This is a fallopian tube. This is where, when an egg or an ovum is released, it travels down this tube towards the uterus, and this is where fertilization occurs. This is an ovary. This is where eggs/ovum are produced and released into the fallopian tube. This is an ovarian ligament, which attaches the ovary to the uterus. Three types of ovarian cancer that we're going to highlight here are epithelial ovarian cancer. 90% of ovarian cancers are epithelial in nature, which occurs in the outside layer of the ovary. Stromal ovarian cancer occurs 7% of the time with ovarian cancers, and it occurs in the ovarian tissue. Germ cell ovarian cancer occurs in egg-producing cells. When they occur, they are oftentimes benign, meaning non-cancerous, but when they are malignant, meaning cancerous, treatment is effective in 90% of the germ cell ovarian cancer cases. With epithelial ovarian cancers, there are oftentimes either no early symptoms or very few early symptoms. When symptoms do occur, they include abdominal bloating or swelling, quickly feeling full when eating, weight loss, pelvic discomfort, changes in bowel habits, frequent urination, pelvic pain, pelvic pressure, unexpected vaginal bleeding, gas, nausea, vomiting, and loss of appetite. Now, someone does not have to have all of these symptoms, and two women may not have the same symptoms. One woman may have abdominal bloating or swelling, changes in bowel habits, and unexpected vaginal bleeding, while someone else may have weight loss, frequent urination, pelvic pressure, and gas. Because these symptoms can be confused with other conditions that ovarian cancer is often diagnosed as are premenstrual syndrome, irritable bowel syndrome, or a temporary bladder problem. Risk factors for ovarian cancer include a family history of ovarian or breast cancer, particularly if this is a close relative, such as a sister or a mother. Reproductive history, that is, a woman that has her first child after the age of 35 has an increased risk of ovarian cancer. That does not mean that she will develop ovarian cancer, there's just an increased risk. Dietary factors such as a diet with increased saturated fat increases the likelihood of ovarian cancer, as does an increased BMI or body mass index. The use of talcum powder has been associated with ovarian cancer. Gene mutations, particularly among the BRCA genes, BRCA1 and 2, increase the likelihood of ovarian cancer. And just because someone has this gene mutation, that does not mean that they will develop ovarian cancer. It just increases their likelihood. Using fertility treatment also increases the likelihood. And smoking. As with all cancers, smoking increases the likelihood of developing ovarian cancer. Diagnosis. Diagnosis of any condition, including ovarian cancer, should begin with a physical exam and a medical history. Specific to ovarian cancer, testing done to diagnose ovarian cancer includes imaging tests such as ultrasounds, MRI, and CT scans to locate tumors around the ovaries, laparoscopy, biopsy, barium enema x-rays, chest x-rays, PET scans, and colonoscopies can all be useful in determining whether the ovarian cancer has metastasized, i.e., has traveled to other locations of the body, and can also help in determining the staging of the ovarian cancer, which is how far along the cancer has developed. Treatments for ovarian cancer include surgery, which would be the removal of the tumors, ovaries, and possibly other internal reproductive organs, chemotherapy, targeted therapy, which are medications that target only the cancer as opposed to a medication that works throughout the entire body. Palliative care, which is relieving the pain and the symptoms of the ovarian cancer. Radiation therapy, which is, of course, using radiation to target the cancer cells. And immunotherapy, which takes advantage of an individual's immune system. Genetic testing. Genetic testing can be done to search for gene mutations. If you have a family history of either breast cancer and or ovarian cancer, you should consider having this done. Having a gene mutation, particularly in the BRCA1 and BRCA2 genes, makes some individuals more susceptible to certain cancers, such as ovarian cancer, breast cancer in both men and women, prostate cancer, pancreatic cancer, and the melanoma cancers. And again, if you do have the gene mutation, particularly among the BRCA1 and BRCA2 genes, this does not mean that you will develop cancer. It just means that you have an increased susceptibility. Thank you for watching this video today. I hope that you have learned something. Please subscribe to our channel below. And for more information on ovarian cancer and other topics, please visit our blog, Healthy Living, Be Good to Yourself. Thank you.